Let's see if I get dragged off the stage because I've gone over time. Good morning, and I have a lot of notes here to keep it moving. Already, I'm wasting time. All right, my name is Dr. Victor Nwankwo, and I'm happy to participate on this talk. I'm working with the Aim Ahead cohort as well, and I'm pleased to participate as part of this team or group. For me, it's really most important as you all are kind of looking at the trees. I kind of wanted to talk a little bit more about the forest and more of a higher overview just to kind of ground us in some conversation. All right, how do I go to the next slide? Got it. So as mentioned before, I'm from the University of Chicago in Illinois. I'm a clinical translational scientist, trained both in clinical medicine, internal medicine, and clinical informatics, as well as a computer science graduate and biomedical informatician, having done postdoctoral research fellowships on the East Coast. And coming into this conference, I asked myself, what can I share that would be novel for this very learned group? You're all very smart, you all have great methods. So I kind of want to just generally speak about harmonizing health equity in the setting of multiomics in 8 minutes, well, 6 minutes or less. Finally, I have no disclosures other than I come to Montreal a lot and I love this town. So it's all in the title. My title for my talk is Modern Intuitive Tools for Managing AI, ML Data, and Health Equity Focused Multiomics and Population Studies. That's a mouthful. So, but it is all in the title, right? So what I would like to do is go through each one of these words, kind of backwards from the back going up, and just see how it all ties together. So a not so offensive and easily digestible definition of multiomics is given to us by our friends at Illumina that say, and I paraphrase, multiomics is an integrated approach to power discovery across multiple levels of biology, including but not limited to genomics, transcriptomics, epigenetics, and proteomics. They left out microbiomics, so that should be up there. And with the goal of achieving a comprehensive understanding of molecular change, contributing to normal development, cellular response, and disease. Okay, so this figure that you see here is from 2018. Seems like a generation ago in this industry, but it does kind of show all of these different data types and the deluge of data that's important in these ML and AI methods. The issue though here is that, as was said by several others, you always run into the risk of overfitting the model to the training data and thus not being able to predict outcomes on unseen data, right? So maybe that last statement will start to kind of give you a clue as to why we're going to talk about health equity in this case. So when we look at which populations are typically studied in genome-wide association studies, we can see from this up-to-date data on the left-hand side that the majority of the GWAS populations are of European descent, 96% to be specific, compared with less than 1% African-American, Afro-Caribbean, Hispanic, and Latin American participants combined. So I look around the room, I see three Black faces. So there's less representation in this room than there is in these studies that are supposed to give us robust and interesting outcomes to actually affect change, right? Crazy. Now with multiomics, the problem is compounded when we talk about adding other signals, right? Such as expression quantitative trait loci, QTL studies, right? But unsurprisingly, these same participants in these eQTL studies, the expression data studies, are also mostly European. So even if you did discover or pick up a signal that might have been found in a GWAS study for somebody that has been typically excluded, you might not actually be able to have that annotated function to associate it with or to connect it with. And so the quintessential example of this is a found opportunity is the image on the right. You might recognize it. It's the PCSK9 region, and it's an example of how a drug discovery for hyperlipidemia, this target was found simply by using non-homogeneous data. Simply by adding people of African descent, we were able to find a new class of drug that allowed us to, target the quote unquote bad cholesterol. So Now we have to ask ourselves, was this a lack of access or a lack of offering? Hard to say. So to look more fully at this, let's look at health equity, right? So the definition of health equity, and I'll skip through this quickly, is simply, there's a long definition, it's going to take up too much time, but it's parity in healthcare plus demarginalization plus empowerment. That's sort of what I squished it down to from the long title that has been given, or the long definition that's been given. But somehow when I think about the PCSK9 story and the question if it was lack of access and this paper that was that coined the term historically excluded populations, it does make me think of a concept that is a bit far away from everything we're talking about. It's mostly social science, but it just popped in my head. And that's something called redlining. Who's familiar with redlining in this room? Excellent. I'm glad that there aren't, because now you've learned something. So simply put, redlining is a discriminatory practice, part of the legacy of America, in which financial services were withheld from neighborhoods that had significant amount of racial and ethnic minorities or populations. So the history of redlining, unfortunately, has been shown to have effects on our modern contemporary measures of social determinants of health. And because redline neighborhoods were disproportionately Black, and green line neighborhoods were disproportionately white, then you now have a situation where something like this occurs and you actually have changes in outcomes of people's health based on their actual region. And it's this geospatial data that's actually quite important to me when adding into genomic studies as well. So let's switch gears for the next 2 minutes, or 3 that I have, and talk about how we're managing the data. So another item in the title was managing data, and most of the data from AIM Ahead comes from these particular sources. I was a big fan of the OCHIN data, which is a lot of electronic healthcare record data from across these different great states. Now, most of the work that we do is being done in Amazon, which is again amazing because now I'm using Amazon, one of the big 6, to do my bioinformatics work, when years ago I was using these like crazy workbenches. So that is why I'm actually bringing this one up. Now, when we go back to multiomics and actually use the AWS workbench, you might recognize that figure on the right-hand side, which is a representation of how people try to harmonize or kind of gather multiomics data. But I especially like AWS because for me, it was not only just important to include multiomic tools at my fingertips, but also the exploratory data geospatial data analysis techniques as well, which this offers. If you actually look at this next slide, almost there. New to this Amazon suite is this thing called the AWS multimodal tools, which actually helps you a lot easier kind of bring these things together. And I highly recommend it because not only is it on the Service Workbench where you're using your Jupyter notebooks and these types of things, but now you actually have it where they're focused on the types of problems that you all are describing. So we're almost, that brings me to my last 2 slides, and we ask ourselves, how can we visualize this? So I'm a big fan of information visualization, just love it. It's the only one I put on my tag, BioViz. Anybody BioViz in here? No? Okay. But basically, the figure on the left shows a typical single cell multiomics workflow, and then the thing on the right shows a Harvard paper, which is really amazing, that kind of shows the different taxonomies of visualization techniques. Combining both of these, my Jupyter notebook has these types of images on the surface of it in order to better navigate, better understand, better harmonize my data. So the reason why I'm showing you all of this is because I actually believe that if you use real robust interactive tools in your Jupyter notebook, things become fun all of a sudden. So I'll end with this, and this is from the same study on historically excluded populations in multiomics. A picture is worth 1,000 words, and pictures like this can help us that we face in our multiomic research. And this is why I leverage information visualization of multimodal data as a vital and modern and intuitive tool in my toolbox. So thank you very much. Any questions? You didn't stand up. How did I do?
You did 7 minutes.
7 minutes. Oh,